Hello, my name is Christine, and today I wanted to talk about non-alcoholic fatty liver disease and the factors that determine the need for a transplant. Non-alcoholic fatty liver disease is a disease characterized by fatty buildup in your liver and is closely associated with metabolic syndrome. The factors that put patients at risk of developing a fatty liver are 1. Being overweight or obese, 2. Having high cholesterol or triglycerides levels in your blood, 3. Having high blood sugars or the diagnosis of diabetes, and 4. Having high blood pressure. Lifestyle modification is mainstay of treatment, including dietary changes and exercise, with the primary goal being weight loss. Having the fatty liver itself does not damage the liver, but it can develop into a more serious condition where the fat accumulation is associated with liver inflammation, which will ultimately lead to liver scarring. Patients with ongoing inflammation have higher likelihood of disease progression. Liver cirrhosis occurs when there is a substantial damage to the liver itself, that the cells are replaced by the scar tissue, which results in an irreversible state of disease, which then may require a liver transplant. With the estimated 20% of patients with fatty liver developing cirrhosis, is becoming the leading indication for liver transplant in the United States. Because fatty liver is associated with many metabolic complications after the transplant, specific evaluation of their metabolic risk factors is important to improve their outcomes. Let me go over some of these risk factors. 1. Patients need adequate control of their blood glucose. 2. Assessing their nutrition status is important, as first-line intervention is lifestyle modifications for patients who are overweight or obese. And 3rd, assessing their cardiovascular health is mandatory because increased risk of coronary artery disease would prevent any transplant. Kidney function needs to be monitored carefully due to the risk of acute kidney injury. And 4, patients will be screened for cancers, especially those arising from the GI tract prior to transplant. Patients who have good control of all these risk factors are ultimately considered for a transplant. Currently, there's no FDA-approved therapy for this disease. Dietary and lifestyle modification is the mainstay of treatment. Given the global rise in metabolic disease such as diabetes and high blood pressure, monitoring of their risk factors is necessary for evaluation before the transplant, as well as optimal management of any complications after. Thank you all for listening.